Good day, I am Dr. Siko from Mzantsi Medics. Today I'm going to be talking about an important medication in the emergency department or emergency setting, which is adenosine. A downloadable PDF document of the adenosine summary is available on the Mzantsi Medics website. This is a visual imagery of how adenosine looks like. Adenosine is a drug that has been used for its antiarrhythmic properties. Adenosine is mainly encountered in the intensive care units, high care units, and in emergency departments in the management of tachycardia. It is available in some emergency centers in Mzantsi, Africa. In Mzantsi, Africa, adenosine is approved by the South African Health Product Regulatory Authority, also called SAPRA. The use of adenosine is also recommended by the South African Medicines Formulary. It is recommended in the adenosine is also recommended in the Standard Treatment Guidelines and Essentials Medicines list of South Africa. As you will see later on in this video, that it is recommended for the treatment of supraventricular tachycardias. Let us look at the classification of adenosine. Adenosine is classified as a miscellaneous antiarrhythmic drug. Remember, there are 4 drug classes of antiarrhythmic drugs. They are class 1, class 2, class 3, and class 4. Due to its unique mechanism of action, adenosine does not perfectly fit into one of these classes, and therefore it is classified as a miscellaneous antiarrhythmic drug. Other drugs in the miscellaneous category include digoxin and magnesium sulfate. They too have got their unique mechanisms of action. Let us look at the mechanism of action of adenosine. Adenosine results in 2 electrophysiological effects in the heart during the repolarization phase. Firstly, the enhancement or promotion of potassium efflux in the atrium, AV node, and SA node. And secondly, the inhibition of the voltage-gated calcium influx channels in the AV node. This picture shows the effects of adenosine on the cardiac action potential. Adenosine results in the cardiac action potential reaching resting membrane potential or hyperpolarization quicker, and a shorter cardiac action potential and quicker stabilization of the cardiac membrane. There is one classical and highly documented indication for the use of adenosine. Adenosine is indicated in the management of unstable supraventricular tachycardias, which are due to a re-entry mechanism, such as atrioventricular nodal re-entry tachycardias and atrioventricular re-entry tachycardia, for example, Wolff-Parkinson-White syndrome. Especially those tachyarrhythmias that have not responded to vagal maneuvers. Revisit the tachycardia with a pulse ACLS algorithm for better understanding. This picture shows part of the algorithm of symptomatic tachycardia in a patient with a pulse. Adenosine has numerous side effects. Fortunately, most of them are short-lived due to the short duration of action of adenosine. These side effects include flushing, chest pain, bradycardia, asystole, bronchospasms in patients with reactive airway diseases such as asthma, coughing, joint and arm pains, hypotension, nausea, dizziness, paresthesias. The following are some of the contraindications of adenosine: a true hypersensitivity to adenosine, atrial fibrillation, atrial flutter, ventricular tachycardia, type 2 second-degree AV block, third-degree AV block, and asthmatic patients. Let us briefly look at the pharmacokinetics. Adenosine has a very short half-life of 10 seconds. Adenosine is metabolized by red blood cells and vascular endothelial cells and is excreted via the kidney. The first dose of adenosine is 6 mg. The second dose, if required, is 12 mg and is given 1 to 2 minutes after the first dose. Each dose is given as a fast intravenous bolus over 1 to 3 seconds, and it should be followed by a saline flush of 20 milliliters. Some closing remarks. Follow the guidelines of the center that you are currently working in. Revise the management of symptomatic tachycardia with a pulse in order to get a better understanding. Continuously revise emergency drugs. Adjust your management according to the latest guidelines. These are some of the references that have been used for this video summary. Thank you for watching this video. Please like the video, share the video with your colleagues and friends, leave a comment down below, and subscribe to my channel to see more videos. I thank you.